CDS Conversation Series: The Impact of Policy Responses to COVID-19 on Disabled People.
So thank you also for this opportunity to add my introduction and welcome to attendees to a Centre for Disability Studies event, and to our two wonderful speakers today, Teo and Ciara. Thank you for being with us, and our colleagues, Mark and Miro, for their acting as discussants. So just a brief introduction to the Centre for Disability Studies for anybody who is not familiar with our work. We are an interdisciplinary centre for disability studies with a firm connection to disability politics and history thereof. We emerged out of the disabled people's movement in many respects, having been originally the Disability Research Unit of the British Council of Organisations of Disabled People. And many of you will be familiar with the work of our founder, Professor Colin Barnes, and we stand on the shoulder of giants and are informed by his work, which has always been really at the forefront of disability and social justice, and really striving to ensure that the academic work that we do is informed by and relevant to disabled people and their organisations in the fight to achieve equality, human rights, social justice for disabled people here in the UK, but also around the world. At that point, I'm going to stop because I would really rather that we got into the discussion, but welcome everybody, and we do hope that you will join us for future events as well. Thank you.
Lovely, thank you, Angharad. So before I give the floor to Teodor and Ciara, I'll just introduce you both briefly. So Teodor Mladenov is currently a senior lecturer at the at the School of Education and Social Work at the University of Dundee. Previously, he was a Marie Curie Individual Fellow at the European Network on Independent Living and the Leverhulme Early Career Fellow at the Centre for Public Policy Research at King's College London. Teodor has research expertise and interest in disability studies, disability theory, international social policy, socialism and post-socialism, and critical theory. He's the author of Critical Theory and Disability, a phenomenological approach, and Disability and Post-Socialism. Ciara Brennan is an independent researcher based in the Republic of Ireland. For the past 12 years, she's worked as a researcher and a consultant at the international, national, and local levels. Her research interests include independent living, personal assistance, deinstitutionalization, and human rights monitoring in emergency situations. Recently, she was the research and advocacy consultant for the Global Disability Rights Monitor. She has also written a report for the International Disability Alliance on the experiences of disabled people in the Global South. She holds a PhD in disability studies from the University of Iceland, and her PhD focused on independent living and personal assistance in the Nordic context. So welcome, Teodor and Ciara. I give you the floor. Thank you.
Thank you, Claudia and Angharad, and thank you for this lovely invitation and this opportunity to share our work, our research. So let me first try to share my screen again. I hope that you can see it now.
Yes, we can.
Yeah, okay. So this presentation that we've prepared today is based on a paper that I and Ciara published in the Sociology of Health and Illness earlier this year in September. and the paper itself is grounded in the findings of the COVID-19 Disability Rights Monitor. The Disability Rights Monitor was an action piece of research set up by a coalition of international disability rights organizations. And it was conducted in the summer of 2020, so during the first phase of the COVID pandemic. And Ciara was the leading author of the report, the Disability Rights Monitor report, and she will be able to tell you more about the monitor itself and the methodology and the process. Our paper in Sociology of Health and Illness draws some broader policy and conceptual conclusions on the basis of the findings of the Disability Rights Monitor. We tried to build on these findings and bring them in contact with some concepts from disaster studies and from disability studies. And we will be talking about this in the second part of the presentation. Let me try to change the slide now. Yeah. Before we actually begin, I would like to set the stage by sharing with you some of our most basic observations that that informed our work. We began by making a distinction between the impact of COVID-19 and the impact of policy responses to COVID-19, and we think that this is an important distinction. It helped us with our focus. Our analysis was motivated by the findings of the COVID Disability Rights Monitor, and particularly the finding that throughout the world, policy responses to COVID-19 have been disability exclusive rather than disability inclusive. We also observed that these disability exclusive policy responses have in many instances been more harmful for disabled people than the virus itself. Another initial observation that informed our work was that policy responses to COVID-19 have been overwhelmingly grounded in the individual or medical approach to disability, individual or medical model of disability, which is reflected in representations, overwhelming representations of disabled people as inherently more vulnerable, individually biologically more vulnerable to the virus than non-disabled people. In the paper, we draw on the COVID-19 Disability Rights Monitor findings in order to analyze critically these features of the pandemic. So I now will let Ciara tell you more about our empirical base, the Disability Rights Monitor and its findings. And Ciara, I can change the slides for you if it would be okay.
That would be really helpful. Thanks, Theo. So thanks so much, everyone, for inviting us to present here today. To begin with, just to give a little bit of background about the COVID-19 Disability Rights Monitor, it's really important to say that this was an incredibly ambitious project, which was put together so quickly during the first wave of the COVID-19 pandemic. It was put together to conduct emergency monitoring of disability rights by a consortium of 7 disability rights organisations, which included the Validity Foundation, the European Network on Independent Living, the International Disability Alliance, Disability Rights International, the Disability Rights Unit at the Centre of Pretoria in South Africa, and the International Disability and Development Consortium, and the Disability Rights Fund. The findings of the COVID-19 DRM illustrate the catastrophic impact of the pandemic on disabled people. And the real aim of this project was to really sound the alarm for a need for urgent action to address the policies that were causing further harm to disabled people, such as denial of access to healthcare and imposing dangerous lockdowns on overcrowded institutions. So it's also important to say that a lot of these organizations were hearing these stories on the ground, but they decided to take action to gather empirical research of what was happening, and that's the basis for the Disability Rights Monitor. So just to move on to the next slide there, Theo, please. The data was collected through an online survey between the 20th of April and the 8th of August 2020. The survey was translated into 25 languages to try and maximize the response from around the world. And a lot of the time, the translations were just done voluntarily, drawing on a real kind of community, project. People were very willing to give up their time to translate the survey into several different languages. So the survey in total received 2,152 responses from 134 countries. The countries with the most responses were Germany, France, Austria, the USA, South Africa, Mexico, Canada, and Nigeria. And again, people really tried to draw on their contacts in these countries to disseminate the survey as widely as possible. The majority of respondents were disabled people. They made up about 41% of the total responses, and a further 25% of the responses were from disabled people's organisations around the world. The emergency nature of the survey, however, did lead to several limitations. So there was no easy to read version available, and the survey was limited to those with internet access. There was also some regions of the world that were poorly represented in the findings, and these included Latin America. Despite the survey being translated into several languages, we did receive a poor response rate. So in terms of the responses to the COVID-19 DRM on the next slide, the survey had both open and closed questions. And one of, I suppose, the really surprising factors for the people who designed it was just the sheer volume of qualitative responses that were received. There were in total around 300 written responses. However, most of these went into incredible detail about what was happening on the ground. So we really got a sense of people just taking a lot of time out of their day in an incredibly, I suppose, difficult situation to sit down and to write very vividly about what was happening in their country. So just to give you a quick idea of the different responses from around the world, here we have some quotes. For instance, one of the respondents from a Belgian DPO, who was also a disabled person, wrote that children in institutions are strictly confined, can no longer have contact with their families. They are really imprisoned, while the providers, being the service providers, bring the virus. A respondent from a DPO in Nepal wrote that people are deprived of food and are in financial crisis, and the government has not provided any benefit. Another participant from a DPO in Nigeria wrote that disabled children and their parents are still on the street with no face masks, no social distancing. their lives are in danger. A respondent from a DPO in Rwanda wrote that wanderers with psychosocial disabilities have been removed to a psychiatric facility to keep them inside by force. So I hope that these, these very brief snippets of responses just show the gravity of the situation that was facing people, and I think that that they're really, really well captured in the qualitative data for the DRM. So just to move on to the next slide there, Theo, please. Thanks. So Theo and I, at the beginning of this article, I suppose, set out to search for a conceptual lens for analysing the findings of the COVID-19 DRM report. We explored the concept of social vulnerability in disaster risk management, or disaster studies as some know it as a lens to analyse the social, economic and environmental conditions that were disproportionately exposing disabled people to COVID-19, the disasters and hazards associated with it. In contrast to individual models of vulnerability, which emphasize fragility and medical conditions, social vulnerability highlights the common structural features of injustices experienced by disabled people during the COVID-19 pandemic, and injustices experienced by other marginalized groups that are routinely identified as vulnerable. So the concept of social vulnerability is well developed in disaster risk management and has been applied to analyse why certain cohorts of the population are disproportionately exposed to hazards and natural disasters. Based on the findings of the COVID-19 Disability Rights Monitor, this seems to sit very, very well and really, which highlighted the disproportionate impact of the pandemic on disabled people, not only as a result of the virus itself, but because of pre-existing social structures where certain social factors create the effects of natural disasters on marginalized groups. Theorists in disaster risk management have pointed to the structural factors such as poverty, segregation, and discrimination, and how they affect a community's exposure to risk and their ability to recover from disaster events. So now just to move on to the slide on health inequalities and vulnerable groups. Theo, the next one, I think. So the distinction between health inequality and health inequity is important for understanding the differences between individual vulnerability and social vulnerability. Health inequalities simply indicates differences in health, which are natural, whereas health inequity really focuses on a value judgment, referring to differences which are avoidable and unfair. And this distinction has been quite well developed within disaster studies. Other factors, including structural racism, drives the social marginalization, for instance, of racial and ethnic minorities and other vulnerable population, leading to inequities in mobility and mortality. So this has been well explored in relation to other groups, but we're expanding on that idea in relation to disabled people. So I'll now pass the floor on to Theo to continue with the findings in our article.
Thank you, Ciara. We also wanted to put these ideas in touch with some key concepts in disability studies. We wanted this key concept in disability studies to be part of our conceptual framework. And so we thought about the social model of disability, the independent living philosophy, the idea of intersectionality as it has been used in disability studies, as well as the concept of biopower. So I'll just very briefly go through these concepts now. The social model is about focusing on disabling barriers instead of individual impairments, and the concept of social vulnerability we consider to be a close relative to the social model of disability. Disabling barriers have been enhanced during the pandemic due to policy responses to COVID-19. This is the point of intersection between these two concepts that we consider is important from a disability studies perspective. That said, we recognize that the experiences of disabling barriers are shaped by experiences of impairments, but nevertheless, in our paper, we focus on the barriers. The concept of intersectionality, we understand it as a focus on the interactions between different social divisions. Both the experiences of disabling barriers and of individual impairments during the pandemic have been constructed in interaction with other social divisions, such as race, gender, socioeconomic status, age, and so on. For example, disabled women and disabled children have been affected particularly hard by the policy responses to the pandemic. I will say more about the intersectional issues in a moment. Independent living philosophy is about choice and control, and using the concepts, the ideas of choice and control to criticize institutional forms of care. Institutional confinement intensified during the pandemic, and the harms of institutions highlighted by independent living activists have become more prominent. And finally, biopower. Analysis of care and cure in terms of social control gravitate around this concept. So this is the way we use the concept of biopower in the paper. We are aware that there are different interpretations of this concept, but we opt for a more kind of normatively heavy interpretation of biopower. During the pandemic, biopower has sometimes intensified when care and cure have become more interventionist. Again, I will say more about this in a minute. In some cases, however, biopower has also transformed into its opposite. And we use the concept of thanatopolitics to identify this opposite of biopower. If biopower is the politics of enhancing life, thanatopolitics is the politics of administering death. Particularly, this has been the case when access to healthcare has been denied to disabled people, most prominently during the first phase of the pandemic, the early months in the 2000s. So this is our conceptual framework, and we used this framework to analyze three prominent features of the pandemic, of the policy responses to the pandemic that kind of emerged out of the findings of the COVID DRM. And the first is the intensification of institutional harms. The problems that characterize residential institutions in general, highlighted by independent living activists, have either worsened or become more visible since the time of the first COVID-19 lockdowns in March 2020. The COVID-19 Disability Rights Monitor testifies that the right to life in residential care has been undermined. It has been undermined through intensification of neglect, denial of access to health care of institutional residents, failure to implement social distancing, to provide protective equipment in institutions, understaffing of institutions, inadequate staffing of institutions, over-medication, lack of mental health support. Together with the right to life, the right to liberty has also been further restricted through intensification of internal surveillance and control, as well as through bans on leaving institutions and on having visitors that have enhanced individual suffering of both the residents and their relatives. Together with this, community supports have been have broken down, have disintegrated, or have been reduced in many cases, which further restricted opportunities for disabled people to be included in the community and to live independently. And this has included difficulties in accessing food, medication, in access to information. Social distancing and other restrictions have undermined both personal assistance for disabled people, and there have been many reports of difficulties accessing personal assistance, as well as support for informal carers. Support for informal carers has also been undermined. As a result, we argue that flawed responses to disabled people's social vulnerability, such as institutional care and reduction in community support for community living, have enhanced individual vulnerability. And there has been this vicious cycle of self-justification, measures that have been justified through individual vulnerability has actually enhanced individual vulnerability, and so on. The next feature of the pandemic, the next harmful feature of the pandemic from the perspective of disability rights, have been intersectional harms. Those disabled people who have deviated from the intersectional norm of the able-bodied adult male, financially secure urban dweller, in multiple ways have experienced stronger marginalization in comparison to those whose deviation has been restricted to being disabled. I have provided here several examples from the Disability Rights Monitor concerning the intersection between disability and age, gender, financial status and place. So the intersection between disability and age has conditioned exclusion of disabled children from education due to shifts to online schooling characterized by inaccessible teaching and learning processes and environments. The intersection between disability and gender has conditioned exposure to gender-based violence due to lockdown restrictions and inaccessibility of support for victimized disabled women. The intersection between disability and poverty has conditioned exposure of homeless disabled people to measures of compulsory institutionalization, compounded by a lack of adequate community supports. And the intersection between disability and place of residence has meant that disabled people who live in remote rural areas have experienced enhanced levels of digital exclusion during lockdowns, together with more difficult access to other types of supports. In all of these cases, considering disabled people's vulnerability from an intersectional perspective makes its social dimension more conspicuous. And here we find the usefulness of the concept of intersectionality for understanding the social vulnerability of disabled people. Together with this, the approach of intersectionality could help prevent an overwhelming individualization and medicalization of disabled people's vulnerability. And finally, we focus on access to care and cure in the paper. Rendering disabled people as individually vulnerable makes them more amenable to biopolitical governance or to social control through care and cure. And the concept of biopolitics helps to illuminate this dark side of care and cure. Indeed, during the COVID-19 pandemic, being recognized as individually vulnerable has drastically restricted disabled people's freedom of movement, has imposed new classifications and new mechanisms of surveillance, as in the case of shielding in the United Kingdom, where disabled people have been ordered to stay at home. The extreme case of this use of the category of individual vulnerability to control disabled people's lives during the pandemic has been, as we have already argued, the intensification of institutional confinement and institutional harms suffered by people in residential institutions. However, we have also observed, particularly during the first stage of the pandemic, the opposite mechanism, denial of care and cure, which have importantly been similarly grounded in individualized understandings of vulnerability. The COVID-19 Disability Rights Monitor collected multiple testimonies of disability-based discrimination at hospital triage from various countries around the world. In the UK, we had the notorious "Do Not Resuscitate" notices that attracted much critical attention during the early stages of the pandemic, but similar exclusions, similar types of discrimination have happened in other countries as well. So to summarize our point here, a biopower-aware analysis of policy responses to COVID-19 from the perspective of social vulnerability needs to consider both the mechanisms for controlling disabled people through practices of care and cure, and the mechanisms for letting disabled people die through policies based on utilitarian calculations. It may even be the case that the immersion of disabled people in practices of biopower and biopolitical practices has rendered them vulnerable to thanatopolitical interventions, and this has been argued by Leonard Davis, the American disability studies scholar, in an article published early in the pandemic in Critical Inquiry in 2020. So to conclude this quite grim presentation, we would like to make 2 points. The first concerns disability policy, and the second concerns disability theory. In terms of disability policy, we advocate for shifting the attention from individual to social vulnerability in policy responses to disasters such as COVID-19, so that social vulnerability is considered at least on a par with individual vulnerability. Again, we think that individual vulnerability has taken the center stage, and this has had harmful consequences for many disabled people. In theoretical terms, we highlight the relevance of the concept of social vulnerability, prominent in disaster studies, for disability studies, and we emphasize the links between this concept and key concepts, key ideas in disability studies, such as the social model of disability, the independent living philosophy, intersectionality as used within disability studies, and biopower, again, as it has been used within disability studies. And we ground this policy and this theoretical proposals in our analysis of the results of the COVID-19 Disability Rights Monitor. So this is what we wanted to tell you today. But before we vacate the floor, Ciara, do you want to add something?
I don't have very much to add, Theo, other than, I suppose, while this is all very grim, obviously, there were a few kind of isolated examples where it was very much DPO-led emergency responses to the pandemic. So it was very much at a local DPO level, whereby, for example, they tried to give accessible information, tried to supply people in rural areas with PPE at the beginning of the pandemic. So there were those, isolated positive cases, but it was very much DPO, disabled person led. And I just think that's also a really important point, to make, just to see that contrast between, I suppose, DPOs and disabled people doing what they could do, in stark contrast to, government policy, very much having this more individual vulnerability model. So that's my final comment, and thanks very much, Theo.
Thank you, Ciara. So yeah, it's indeed it was good to add this positive positive finding at the end, although the DPOs were overstretched themselves, and so yeah, okay. So this is what we wanted to tell you today, and we will be very happy to hear now from our discussants and from the participants.
Thank you very much, Ciara and Teodor, for that really interesting presentation, and yeah, very sobering findings. Thank you very much. So now I will pass the floor to our discussants. So with us, we have Dr. Miro Griffiths and Professor Mark Priestley. And I'll just quickly introduce you both. Dr. Miro Griffiths is a Leverhulme Early Career Research Fellow in Disability Studies at the School of Sociology and Social Policy at the University of Leeds. His research explores disabled people's participation in activism, social movements, and resistance practices. Miro holds several advisory positions within the UK government, the European Commission, and supports disabled people's organisations across Europe. And we also have with us Professor Mark Priestley, who is Professor of Disability Policy at the University of Leeds in the Centre for Disability Studies. He was the founding scientific director of the European Commission's Expert Network on Disability. He has previously published research on some of the disability equality issues raised in today's presentation, including models of vulnerability, response and preparedness in emergency situations. So thanks very much, Miro and Mark, the floor is yours.
Mark, would you like to go first?
Either way, Miro. Okay. Great, Ciara, Teo, great to see you as always. And thanks for your contributions, really interesting and exciting. Yeah, and I was reminded, as Claudia mentioned, so about 15 years ago, I suppose it must be now, when we were working on some issues arising in kind of disaster impact and kind of recovery stuff that was prompted by two rather different events. We weren't thinking about pandemics. So in December 2004, the Asian tsunami in the Indian Ocean, which devastated communities across South Asia, and particularly in Indonesia. And 6 months later, there was Hurricane Katrina, which devastated the coast of the United States in Louisiana, New Orleans. And these two very different events, both of which were large, effectively storm events. One was a climatic storm, the other was an earthquake, but with the same consequence of flooding, flood risk, coastal flood risk, and yet these two very different communities, in a highly technological, wealthy society, but admittedly amongst poor communities, poor Black communities, working class communities, and these kind of rural communities in northern Indonesia, in Banda Aceh. And this was kind of really interesting. So, it kind of spurred our interest in that. We did some work with the World Association of Social Workers, and we published two papers, but we followed an almost identical intellectual path to the one that you followed, which is kind of fascinating. So, yeah, we absolutely, that idea of social vulnerability that Ciara was talking about, drawing out of the what do we call it, the disasters literature, if you like, is absolutely key. And I think you're completely right to focus on that in the way that it tries to construct the relationship between human vulnerability and environmental risk. I mean, I think there's a point in your work where you sometimes talk about natural disasters and hazards, and I think one of the lessons of that kind of social model of vulnerability is to separate those things. That in a sense the lesson is there's no such thing as a natural disaster. They don't exist. You know, there are natural hazards. You know, there is rain, there is wind, there are viruses, but hazards are human. They're not. And precisely they're created by these forms of social organization and environments that we put in the way of these risks. So viral transmission, illness, flood risk are of our making, if you like. And I think that's a hugely powerful idea, and that's the one that you've latched onto, which is just fantastic. But I was reminded, that those ideas, they're so similar to, the social model of disability and the kind of social model of vulnerability in that literature, that they really needed to be brought together. And it's funny, just in preparation, I was just looking back at some of that work. The International Strategy for Disaster Reduction, which funnily enough is not about pandemics, because there's a whole other literature about pandemics, and two different parts of the United Nations, one of which deals with climate type environmental emergencies and the other with health, and yet they need to be brought together and with the disability. But I was looking at it's actually from the 1994 edition of the International Strategy for Disaster Reduction, which is some time ago, and I thought I'd just quote from it, because if you imagine social model of disability in your head while but this is about disaster reduction, and they say some patterns of consumption, production, and development have the potential for increasing the vulnerability to natural disasters, particularly of the poor and socially disadvantaged groups. However, sustainable development can contribute to reduction of this vulnerability if planned and managed in a way to ameliorate the social and economic conditions of the affected groups and communities. And I just thought that was such a great quote, so it almost encapsulates the idea of a social model of disability. So I think you're completely on the right track. It kind of trying to synthesize those things together, as we did indeed, in a very similar kind of task. But then looking at the kind of anatomy of the disaster as it unfolds, I think there's, that literature tends to kind of break. It's the natural hazards literature, but tends to break down into sort of 3 or 4 stages of what happens, and I think you articulated those really nicely. So you get that idea of the initial impact, the fact that a wave demolishes a building, or that people are left homeless, and people are killed, people are injured, and the same with the virus. There is infection, there is illness, and there is death, and those things are just tragic in their own way, but their occurrence is also socially created, by those environments, about where those buildings are, how disabled people are congregated into those buildings, how they are in relationships of enforced dependency with the people who run those buildings. And of course, what happened in Indonesia, also in New Orleans, is that the care staff ran away when the wave came, and disabled people were left in those flooded buildings, at the extreme end. So there's immediate impact. There's the kind of immediate response, the sort of crisis response, if you like, of shelter and relief. And again, we heard very similar stories. We had a very similar method to you. We talked to organizations involved in people affected. But the responses to that, people being short of food, being short of shelter, being, and the uneven way in which disabled people, deaf people being unable to access communication support, really, really similar stories. But then you have these other 2 phases about recovery from the disaster over time, and crucially, the idea of resilience and planning. And I think it would be really good to, as you alluded at the end, so trying to think about, well, where do we go from here? How do we, where is the resilience? How do we build these more resilient communities? And I thought it was great that Ciara at the end mentioned the agency of disabled people's organisations. And again, that was a really strong theme in one of the papers that we did about how disabled people's organisations have been able to intervene in peer-to-peer support initiatives, providing people with wheelchairs in emergency shelters, ensuring that raising money even. So disabled people's organisations in the United States sending money to Indonesia and all kinds of really interesting peer-to-peer support. I mean, I thought what you also did really well, I thought was really nice to see that emphasis on intersectionality. And I mean, again, I was just looking at what we'd written, but it's very similar. But those kind of intersections of class, ethnicity, gender, age, and poverty as a uniting or kind of underpinning factor in socially creating that vulnerability. Why was it that working class Black communities in New Orleans were living below the sea level of the defences? Because it's cheap housing. It's a cheap place to build housing. And so when they were flooded, it was those houses that were flooded. So those kinds of vulnerabilities, just cut across, but are ultimately related to class and poverty reduction. So I've said enough anyway, really. I mean, using the idea of biopower, I thought that was kind of really interesting too. And of course, the principles of independent living, your other principle. I mean, in COVID, we saw exactly the same thing in these kind of flood risk disasters, that, people who live in institutions, it just creates this necessary vulnerability to all of these hazards. It's a key predictor of how vulnerable people are in a crisis. And it's counterintuitive because policymakers sometimes believe that where people are looked after and supervised, that they will be safer. But actually the reverse is largely seems to be the case. So that's me.
Thanks, Mark. So I suppose with my time, Theo, Ciara, I'd probably offer some brief reflections and then maybe pose some questions to you, if that's okay. So thank you for your presentation, and I was really struck thinking about the data that you were presenting alongside the broader literature, academic and grey literature, which is demonstrating the different paths or avenues during the pandemic in order to respond to the problem of disability. And what I think is quite pertinent is this fragmenting of disability so that it removes the emphasis on disability as a consequence of the way society is organized, to presenting it as the individual problem. And what that you then offer, which I think is really needs to be explored in further depth and as part of our reflections on the pandemic going forward, is how there is one avenue, which is to exclude disabled people from accessing medical care and treatments. And whether that is to do with impairment effects or due to the consequences of, say, contracting the virus, the protocols are implemented to withdraw and to reallocate. And I think it's this reallocation that is so fascinating in terms of how decisions are made to prioritize certain life over others. I'm reminded of in the US, for example, where states were presenting lists of impairment categories, saying if you have these conditions, don't turn up to hospital because you won't be provided with support. And again, similar in terms of in the UK, the clinical frailty score they were using to determine access to intensive care. So it's this withdrawal and reallocation that constitutes this exclusion on the one hand, but I also think it's supplemented again with this other avenue that you're exploring, which is the abandonment and the silencing of disabled people's voices. So you have the abandonment in terms of just asking disabled people to get on with it, and to in that notion of individual responsibility and self-sufficiency, to address their own concerns and problems and situations that they find themselves in, but equally as well as in terms of denying disabled people a prominent position in the policy-making processes. And of course, when we have aspects of the United Nations Convention and we have the Special Rapporteur arguing for disabled people and their organizations to be part of that decision-making process and to be conceptualizing what good services and support looks like in terms of disaster preparedness, but also in terms of recovery and moving forward in a post-pandemic society. The absence of that, I think, is really telling in the way that disabled people are seen as a problem in terms of how to prioritize existence and life during a pandemic, but also disabled people are not credible voices in offering a perspective on how society ought to be organized. So for me, we get to this position of the examples that you propose are evidence that disabled people are not just forgotten about, but actually they're being targeted deliberately. And I think this leads it back to your points about the biopolitics and the thanapolitics, although I can't pronounce that word correctly, I'm afraid. But I also think it's quite interesting in terms of how we need to think about the continuation of policies that have been developed to, in inverted commas, supposedly increase participation and inclusion in society. So we think about independent living strategies, if we think about personalization agenda and so on, attempts that are supposed to provide disabled people with more choice and control, they are in a precarious situation. And the pandemic illustrates that there is a permanent question over how to ensure that disabled people are protected within not just national situations, but across the globe as well. So I was thinking, as you were talking, the idea of the pandemic and how the pandemic is in one regard makes death a permanence, but of course it also, in the context of disability, reverses the alleged progressions that we've made within disability policy, but also in terms of the demands and activities and strategies that are argued by disabled people and disabled people's social movements. And again, this issue for me, which I think is really interesting, and I was thinking about it in relation to this concept of social vulnerability, is how so often we had articulations and rhetoric which was about states taking responsibility to protect those who are perceived as being most vulnerable, and that occasionally transferred into this notion of clinically extremely vulnerable. And I'd be interested to know what your thoughts are on that terminology and how useful that is for protecting disabled people in a pandemic. But of course, on the one hand, we have this emphasis on asking governments and asking states and those with influential authority to do more. But at the same time, the reaction of many states, and maybe this is linked into issues of political economy, but the response from states then is to ask people to do more for themselves. Of course, reinforcing that issue of self-sufficiency. In terms of questions, and I am conscious of time, and I know we want to move to the Q&A, but I'd be really interested, when I was reading your paper and when I was listening to your talk, I'm aware of the tensions that surround aligning disabled people's experiences with vulnerability, and we know this is well documented. And I'm particularly, and that is particularly pertinent within critiques of, say, political and economic volatility, and when we've seen periods of regressive and residual social security provision. So I suppose the question is there a danger of the social vulnerability framework becoming diluted, particularly within public discourse when it moves beyond academic discussion? And is there a danger then it will reinforce notions of individual responsibility in order to maintain and justify the continuation of programs that you've highlighted, such as segregated and violent regimes, in order to regulate and control disabled people? So could you perhaps, both of you, unpack how you think the conceptual framework could also help mitigate those risks of reinforcing vulnerability, and something that then can be embraced by disabled activists and social movements who have perhaps been quite cautious around the notion of vulnerability and its entanglement with disability?
Shall we now briefly respond?
Please.
Yeah. Thank you. Thanks a lot for this feedback, for these reflections. Indeed, one of the things that struck me while reading the findings of the Disability Rights Monitor was how throughout the world disabled people faced similar barriers and similar exclusions, and that there wasn't much emphasis on the distinction, on the division between the global north and the global south in the in the DRM. And I think that this is because disablism and ableism kind of transgress this boundary, and together with other social divisions such as poverty, racism, sexism, and so on. Yeah, in response to Mark's comments, there are indeed striking similarities with what you did, Mark. Your research on this human disasters. I wish we could have seen these papers before writing hours, because there are so many overlaps. It's uncanny, actually. You ask about what now, what to do now, how to find disability inclusive ways to recovery. We would argue that we should think along the lines of the United Nations Convention and on the rights of persons with disabilities, and we should advocate for community inclusion instead of institutionalization. We should advocate for building or rebuilding community supports. We should advocate for deinstitutionalization in recovery responses, of course, we should advocate for more funding for disabled people's organizations, because it was they who actually acted adequately and properly, rather than service providers or policymakers, in many, if not most, cases. Just briefly, in response to Miro's point about the danger of responsibilizing disabled people and the danger with sticking with the concept of vulnerability, even though qualifying it as social vulnerability, I agree that this should be done carefully. Responsibilization and the emphasis on self-sufficiency is one way in which the ideas of the independent living movement have been misappropriated, particularly in neoliberal contexts. It's an ongoing fight. It's an ongoing struggle, and it's going to be an important aspect of the struggle for disability inclusive recovery after the COVID. So instead of self-sufficiency, we need, as disability studies scholars and disability activists, we need to argue for proper community-based support for disabled people that is organized around the concepts of choice and control. This is the way I see things. Perhaps Ciara would like to also add some responses.
Yeah, thanks a million, Theo. I suppose I have to put my hand up and say, you know, I'm very much a qualitative researcher. So, you know, just when I had the luxury, I suppose, of sitting with so many qualitative responses and really getting a, I suppose, quite a unique insight into what was happening around the world. Yeah, for what Theo said, like, it was really, really striking to see that, you know, there was a lot of high-income countries that were really comparable with what was happening in very low-income countries. Some of the quotes could have, or the comments could have actually been compared side to side. Also, I think one of the things that struck me, and it's in relation to Mark's comments also around natural disasters, is that it's very clear that the COVID-19 pandemic did not exist in a vacuum. And we had responses from countries where there were other natural disasters or humanitarian emergencies occurring. So, you know, while obviously it's important to pay a lot of attention to the pandemic, it's compounded by other, you know, things that are happening in the world simultaneously. So I suppose, you know, I was really happy that Theo invited me to, you know, to analyze the data from more of a disability study perspective. But it's very much grounded in those really, really rich qualitative comments coming from all over the world. That really forms the basis of, you know, what is a theoretical paper, but it's very, very much grounded in those voices, which I suppose, like, one of the key aims, as well as raising the alarm about, you know, the impact of the pandemic on disabled people, one of the other key aims is just to really try and amplify those qualitative comments, and, you know, just to be grateful for people to actually have taken that time to share those perspectives. I really agree with you, Miro, in terms of the, you know, vulnerability is an incredibly loaded term, and as you said, Theo, like independent living and other, you know, I suppose other terminology that has been hijacked both politically and by, you know, other organizations with ulterior motives to sort of do the opposite. So it is important to be incredibly explicit about, you know, what we mean by social vulnerability in this context. However, I do also feel that it does bridge a lot of gaps between, you know, the experiences of disabled people and other, I suppose, cohorts of the population who have, you know, been disproportionately exposed to both the pandemic and other natural disasters also. So I feel from that perspective, it does give some insights, yeah, into the injustices, into the policy responses that can affect people differently and expose them unnecessarily, including overcrowded living conditions being one of the main ones from the report. So yeah, I would definitely exercise extreme caution when using the term vulnerability, but I think it's also very useful for unpacking, you know, exposure to natural disasters and to global pandemics. So that would be my reaction to that.